More than 6 months into this pandemic, the picture around the world remains grim. The spread of the virus is accelerating in a number of countries. In the span of just 4 days, 1 million more people have been infected with COVID-19. That brings the total number of global infections to more than 18 million, and more than 690,000 people have died. The World Health Organization warns there's still a long way to go in this crisis, and countries must strictly enforce public health measures to get infections under control.
We all hope to have a number of effective vaccines. However, there is no silver bullet at the moment, and there might never be. For now, stopping outbreaks comes down to the basics of public health and disease control.
In Australia, authorities are taking aggressive steps to try to get a major outbreak under control. After weeks of spiking case numbers, they've declared a state of disaster in the state of Victoria. With that come a series of sweeping new restrictions for a region that's already been in lockdown mode for weeks. Redmond Shannon reports on the shock and awe tactics in a region that had been one of the world's great success stories.
Melbourne, Australia's second largest city, deserted under a new nighttime curfew. And now the state of Victoria says all non-essential businesses will close starting Wednesday night.
This 6-week period is absolutely critical. We have got to make decisions, very difficult decisions, but we've got to err on the side of doing everything we possibly can to drive these case numbers down.
If there is such a thing as a second wave, then Victoria is a case study. Australia had all but eliminated infections until the new spike a month ago. It's winter down under, and similar-sized cities in Canada and elsewhere might well look to Melbourne to see how a second lockdown works out.
We'll see the effect of universal mask wearing in the numbers in the week ahead and ongoing. We'll see the effect of these restrictions in the following week.
Plans for an Australian travel bubble with New Zealand now on the back burner.
That will be a long way off, given what they're experiencing right now.
The Philippines is experiencing an even more serious situation.
We're waging a losing battle against COVID-19, and we need to draw up a consolidated, definitive plan of action.
President Rodrigo Duterte bowing to pressure from medics to act, imposing a 2-week lockdown on 25 million people in Greater Manila starting Tuesday.
I fully understand why your health workers would like to ask for such a timeout period. They have been in the front lines for months and are exhausted.
New infections have risen sharply since the first lockdown eased 2 months ago.
It would seem to me that in most countries that have experienced intense community transmission, the way out is long and it requires a sustained commitment.
The World Health Organization says it's also committed to finding the precise origins of COVID-19. It has started efforts in China to find an answer, and more work will be needed with Beijing's cooperation. Redmond Shannon, Global News, London.